name's Stefan. I'm going to be your nurse today. It says here we have a head-to-toe assessment. At this point, I would wash my hands, um, and then I'm going to raise it to a working level and close the curtain. Do you have, before I started anything today, do you have any allergies? No. Okay. Do you have any cultural preferences I need to be aware of? No. Okay. Are you in any pain today? No. Okay. And can you ask me, can you ask me where you are? Galen Hospital. Okay, can you tell me today's date? September 15th. Okay, and then can you tell me the president is? Sure. Okay, so patient is alert and oriented ×4, so we're ready to begin the assessment. First thing I'm going to do is I'm going to don gloves, and I'm going to palpate the patient's head. Is it okay if I touch your head? Okay. First thing I'm going to do is I'm palpate the patient's head. I see no redness, no swelling, no lumps, no lesions, no lice, no abnormalities, excuse me. Hair looks well kept, and there's no abnormalities. So at this point, I would then palpate the frontal and then mastoid processes, sinuses, excuse me. Do you have pain when I touch there? No. Patient has no pain, there's no abnormal swelling or edema in that area. So at this point, I'm going to palpate the lymph nodes, starting with the preauricular, postauricular, occipital, jogodiastric, submandibular, submental, superficial deep. There's deep, posterior, and cervical. Superficial, deep, and posterior. And then the supraclavicular, if you lift your arms, please. The axillary, and the epitropical. Okay? Do you have any pain when I touch those areas? No? Okay. Patient has no pain, there's no abnormal swelling in any lymph nodes. I'm not going to look at your ears. I'm not going to look at your ears. Check your ears. Ears are normal, no excessive cerumen, and you have no sensitivity in the ears, no sensitivity at all. Okay, I ask you to turn your head to the left, or the right, excuse me, and then the left now. Okay, no jugular vein distension at this point. And from the get-go, we put the patient's bed at 45 degrees, so we can do all these inspections. So at this point, I would then remove my gloves. Wash my hands, and the next thing I would do is I'm going to inspect the nostrils. So I have you lean back for me, please. Okay, no redness, no swelling. Septum is midline. There's no deviation, and I just need to inspect your mouth as well. That would be enough. Okay. Mouth is normal, no lesions, no redness, no swelling. You have no pain in those areas. Okay. Patient says they have no pain. At this point, then I'm going to move on to the eyes. I'm going to check pupils, so I'm going to turn off the lights. And I'm going to have you look forward for me, please. Okay. Okay. Turn the lights back on. The patient's pupils are 3 millimeters, constrict to 1 millimeter, and there is 3 millimeters. 3 millimeters. Pupils are equal, round, reactive to light, and accommodating. The conjunctiva is white, or the conjunctiva is pink, and the sclera is white. And the eyelashes and eyebrows, excuse me, are intact. So the next thing I'm going to do is have them do the Snellen chart test. Obviously, I have the patient read, occluding one eye, then the other, then both. Patient did so. The patient's vision is 20/20, no issues there. No corrective lenses required. So next, what I'm going to do is I will inspect the tracheal area. So just let me know if you have any pain while I'm doing this. I'm inspecting the trachea. No swelling, the suprasternal notch, the angle of Louis, and the patient's costal angle is 90 degrees. No redness, no swelling, no lumps, no lesions, anything like that. So at this point, then I would do check the patient's respiratory rate without telling the patient. Patient has respiratory breaths of 16 per minute. Unlabored, chest is symmetrical and is equal chest rise and fall expansion. So at this point, then I'm going to listen to the lungs. So I'm going to start with the tracheal, then bronchial, then bronchovesicular, and the vesicular areas, the regions of the lung. Do tracheal, bronchial, bronchovesicular, vesicular. Okay. Patient breath sounds are normal. No any excess wheezing or anything like that. And I need you to lean forward, please. Okay. And I will check the same regions of the lungs in the back. So we will have tracheal, bronchial, bronchovesicular, vesicular. Okay, and I'll have you staying like that. Yes. So the patient lung sounds are normal. There's no deviations or abnormal sounds. So next, what we're going to do is we're going to check for So next thing we're going to check for is crepitus. So I have you please just lift your shoulders for me. Okay, no crepitus. The patient has equal strength in both shoulders and it's bilaterally. Excuse me. So next what we're going to check for is I'm going to palpate for tactile premises. Okay. So what I'm going to need from you next is when I say every time I touch you, I'm going to need you to say 99, please. Okay. So. Okay. There was no abnormal feelings in my palm. Check tactile premises. Next, I'm going to listen for bronchophony. So what I'm going to have you do is I'm going to have you do 99 again every time I touch you. Is that score? Okay. No signs of bronchophony. Signs are good. Next is egophony. I'm going to check. So this time, instead of 99, I'm going to need you to say E, like a dolphin. Okay. No signs of egophony. Everything sounds good. Next is pectoroliloquy. Excuse me. So this time I'm going to have you just whisper. I just need you to whisper 1, 2, 3. Okay. So. Okay. Okay. No abnormal findings. No bronchophony, egophony, pectoroliloquy, or tactile premises. So at this point, then I'm going to feel the thoracic cage. So just head and breathe normally. And chest rises and falls equally. Shoot. Pause. Computer. Okay, so next I'm going to do is I'm going to have you lean back from me, please. And I'm going to check the heart sounds. And so the first area I'm going to do is the aortic, which is in the I'm going to check the aortic, which is in the right sternal border of the second intercostal space. And then I'm going to check the pulmonic, which is the second intercostal space in the left sternal border. And then it'll be Erb's Point, which is the third intercostal space, left sternal border. And then tricuspid, which is the fourth space, left intercostal border. And then the mitral and tricuspid, which is the left midclavicular and the fifth intercostal space. Okay, I would check all those for 1 minute. And then at that point, I would then go to the apical pulse, and I would listen for 1 full minute. And the apical pulse is normal and matches, and is 70 beats per minute. Then with the Belvis stethoscope, I'm going to look on the Belvis stethoscope. I'm then going to listen for murmurs between S1 and S2. No abnormal sounds, therefore there's no murmurs. S1 and S2 are normal. Next I will do is the abdomen inspection. Excuse me. So what I'm then going to do is I'm going to auscultate the first 4 quadrants. Just by visually looking at it first, there's no bumps, redness, swelling, edema, or anything like that, or pulsations or anything. So next I'm going to auscultate the 4 quadrants. So I start with the right lower, then the right upper, the left upper, and the left lower. No abnormal sounds found there, and now I will move. Now I'll move to palpating the 9 regions of the abdomen. So I'll start in the right hypochondriac, epigastric, left hypochondriac, left lumbar, umbilical, right lumbar, the right inguinal, the hypogastric, and then the left inguinal. No swelling. No swelling. Did you feel any pain while I did that? No pain, no swelling. Normal variations within the abdomen. Next, I'm going to ask: do you do monthly self-breast exams?
Yes.
Okay. Patient acknowledges that they do monthly self-breast exams. At this point, I would then put the gloves back on. Put gloves on, and I'm going to check the femoral pulse and the inguinal lymph nodes. So first, I'll check the femoral pulse. Okay, it is bilaterally. There are 2+ and normal. Next, I will check the inguinal lymph nodes. I'm checking the superficial and the deep lymph nodes. And there's no pain there?
No.
Okay, no pain, no swelling, no edema, anything like that. Now I'm going to remove my gloves again. I've washed my hands. And then I'd have you please just rotate and face the wall for me. Then I'm going to visually inspect the lower back and sacrum area. At this point, I remove the gown, but for obvious purposes. There's no redness, no swelling, no lesions, no pressure ulcers, anything like that. So I have you rotate back over, please. Okay. And I'm going to have you sit to the edge of the bed here, please. Sit in the middle. Okay. So let's have you sit to the edge of the bed. And so what we're going to do, actually. So what we're going to do next is I'm going to have you do your drums. Okay. Can you bend your elbows? Your wrists. Okay. And then no redness, no swelling, anything inspecting the arms. No pressure ulcers, everything looks fine. Then have you grab my fingers, please. Squeeze. Okay. Equal strength bilaterally. And then what I'm going to check is for skin turgor. No tensing, no skin turgor. I check the patient's cap refill. Cap refill is 3 seconds or less. So everything is normal there. And at this point, I palpate and check the brachial and the radial pulses. So I'm going to just lift up the sleeve, please. Okay. Okay. Pulses are +2 and normal. So next, what I'm going to check is the reflexes. So first, I will do. So first one I'm going to do is I will do the brachial, brachioradialis, brachial, right, and then the tricep, and then the Achilles quadricep, not the, excuse me, the quadricep, patellar, and the Achilles. All are normal reflexes. There's no variations. That's it for that. So then, as the patient sits up, obviously I had to check the pulse to begin with to make sure there's no orthostatic hypertension. The pulse is still normal. At this point, I would have you please put on your non-slip socks. Okay, so the patient puts on non-slip socks, and then I'd have you just stand up for me, please. Okay, check the patient's pulse again, just to make sure it's still, there's no orthostatic hypertension, no drop in blood pressure. Okay, the pulse is normal. And what I would need you to do, please, is can you take 5 steps that way and then 5 steps backwards for me? Okay, and just come back. Okay, no abnormal gait. No abnormal gait. Walking is normal. Stride is normal. And I just have you please just bend over and touch your toes. Okay. Checking the cervical spine. You can stand back up for me, please. There's no signs of scoliosis, kyphosis, or lordosis. Everything seems normal. Thoracic cage is a 1-to-2 ratio and symmetrical. No signs of barrel chest, anything like that. Can I get you to sit back down, please? Can I actually have you lay down, sorry. Okay, so now I'm going to inspect the lower extremities. So I obviously visually inspect them. There's no bumps, lesions, bruises, anything like that. I then check, I take off the patient's socks that aren't on. I check cap refill. Cap refill is 3 seconds and normal. Then I'm going to check the pulses of the popliteal, the dorsal tibialis, and the dorsal pedis. All pulses are 2+ and regular. No variations or anything like that. And then the last thing I would just need to do here is can you pull your toes towards you? Okay. Can you push down my hands? Okay. Equal strength bilaterally in the legs. No inconsistencies or abnormalities. At this point, the assessment is finished. I would lower the bed to the lowest position, which it's already at. I would then put the handrails up, I put the call bell in reach. I would open the curtain, wash my hands. My assessment is complete. Is there any questions you have for me today? No. Okay, and the assessment is complete.